It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events, and get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to this week's episode of Morton in the Morning, your radio show coming to you right here from Morton Hospital, your community hospital in Taunton. If you're just tuning in, or if this is your first time listening, we have our show every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. And every week we feature a variety of health and wellness topics, or sometimes we have on some of our new doctors. Today we have a great guest, not a new doctor, but someone I think everybody will recognize. Our guest today is Dr. Charlie Thayer. He is a general surgeon here at Morton Hospital, as well as our chief medical officer here. And we're very excited to have him to talk about an interesting topic. Now, we hope you'll listen in every week because, again, we share health and wellness information, talk about our new doctors, but we also share information about, what's happening here at Morton Hospital, events, etc. And it's a great way to stay in the know about what's happening here. But another great way is to follow us on Facebook. So if you're on Facebook, you can search Morton Hospital and then like or follow our page. You can also find us by just typing in facebook.com/Morton Hospital MA. And we would love to have you follow us there as well to stay up to date on everything happening. So really great topic of discussion today about a particular medical issue. So let's jump right into today's show. All right, we are very excited for our guest on today's show. He is no stranger to the show. He's been here before, but he's also no stranger to our community. So he is Dr. Charlie Thayer. Welcome, Dr. Thayer.
Thanks, Julie, for having me.
Thank you for being here, and it probably isn't even necessary because you are so well known here in Taunton and beyond. But tell us about yourself.
Well, I've been on staff here for 38 and a half years. They've been glorious years. I've seen a lot of changes in the hospital. Primarily, there's been a lot more growth.
Yes.
We've had a lot more new things come. We do a lot more surgery that is different that even, was 39 years ago. So it's been exciting. We have a full complement of general surgery here that can take care of a lot of things. And it's been an exciting ride here at Morton Hospital.
Absolutely. And our team, obviously, takes care of some of the general things, but we also have people who specialize in certain things, like Dr. Andrade with breast disease and breast surgery. So wonderful to have them. And how long has Morton Surgical actually been around?
Oh, Morton Surgical actually predates me coming. I joined my father in practice. He'd been established here for about 20 years by the time I came. And we've been in the same location, up in the Thayer building at 72 Washington Street for at least 45 years.
And you have a great team there, especially all of your wonderful office staff.
I have office staff that has worked there longer than I've been there. It's, that's an odd thing to say, but when you think about it, they arrived to help people before I did, even though people think I've been here forever.
They are wonderful, always super helpful, and wonderful personalities up there as well. So before we get into a specific topic that we want to talk about today, what are in general some of the most common types of general surgery procedures that you perform here at the hospital?
Well, our number one consistent elective operation is most likely taking gallbladders out, which is called cholecystectomies. I know, Julie, that you know this, but others probably have come here and don't realize that Morton Hospital was one of the first hospitals in the Commonwealth of Massachusetts to actually use the little teeny incisions, what we call laparoscopic surgery with TV cameras in the abdomen. We started that in 1987, and in 1987 most everybody would say that was interesting, and not many people did it. But now you wouldn't go anywhere in the country or anywhere around the world where that's not the method that would be used to take your gallbladder out. We do appendices, but mostly everything now, except for the true emergencies, everything is pretty much done in a small little, some people like to call it keyhole surgery.
Okay.
Because the incisions are so small. That has changed surgery quite a bit. Some people of a generation, my generation or older, might remember big incisions that were quite painful and took a long time for people to get better from. Those big incisions are very rare now, and people usually go home the same day. On most of the surgeries we do, most of the people go home the same day.
Yeah, that's amazing. I'm sure much different than decades ago.
Oh my gosh, yes.
So how is it that we were sort of on the cutting edge of that Morton Hospital out of everywhere was the first to start doing that? Is that because you were leading the charge?
Well, I think that there were some visionaries here. We had an obstetrician and gynecologist named Meyer Bornstein, who was on the forefront of GYN, gynecology surgery being done laparoscopically. He was rather insistent that this would be the future. And at the time, in the late 80s, there was many different ideas of how we would treat gallbladder disease. And some of them were going to be trying to crush the stones like we do to this day with stones that are in the kidneys. Kidney stones are crushed. And there was a dalliance with that. I actually went to a special class to learn how to operate these sort of ultrasonic crushers. But in reality, that went way, the small little keyhole surgery that was developed eclipsed everything else because it's safe. People go home about an hour or so after they've had the procedure. And I would say the other thing was that we were close to a person who was an expert in this. And one of them, that was Dr. Joseph Amaral, a general surgeon in Rhode Island Hospital, who eventually would become the president of Rhode Island Hospital. And he had invented a lot of instruments that were used in doing this sort of surgery. And he was a friend of mine, and he took me under his wing and taught us how to do it here. So close proximity to an expert, and you could just read the tea leaves that this was exactly what was going to happen.
An ambitious team. So we were on the cutting edge back then. I still feel like we are. We're always introducing, new types of surgeries or equipment that support surgeries. I mean, some of the latest being our Corey robot for orthopedics, and we'll definitely have Dr. Newland on the show to talk about that in the future. But we've always got some really cool equipment that we're bringing into the OR to help us, to help our surgeons.
Well, it's not just about the equipment, of course, it's about the expertise to use them.
Absolutely.
So, there's a lot of flashy stuff, and it makes the news, and people read about the flashy stuff. But in reality, it takes people who have expertise and experience with using these things to make sure that we don't want to adapt them unless we know we can do that. That's the number one thing to do, of course.
Absolutely. So we have a great general surgery team, but we have certainly welcomed many new surgical specialists, especially over the last few years. Lots of expertise
We
there.
have some exciting things coming in ENT for the
Absolutely.
people with sleep apnea.
Yep.
That's called the Insight procedure. And, we have a Corey robot now, which is another form of robotic total knee and total hip surgery. So it's always moving, never staying the same.
All very exciting stuff. and lots more exciting things to talk with you about. In particular, we want to talk to you today about the topic of diverticulitis, as well as some of the other common procedures that you perform here. But first, we do have to take our first break, so if you're just tuning in, we are here with Dr. Charlie Thayer. He is our Chief Medical Officer and a General Surgeon here at Morton Hospital, and we have lots more to come, so stay with us. We'll be right back after this break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
At Morton Hospital, we're proud to be nationally recognized for quality and safety. In addition to recently achieving the Gold Seal of Approval and accreditation from the Joint Commission, the Leapfrog Group has named us as a Straight A's hospital for having received 5 consecutive A hospital safety grades since 2020. To learn more about our achievements and awards, visit mortonhospital.org.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to Morton in the Morning, your radio show coming to you right here from Morton Hospital. If you are just joining us, our show today, we have a special guest, Dr. Charlie Thayer. He is our Chief Medical Officer and a General Surgeon here at Morton Hospital. Our community knows him very well, and he's been around for quite some time, and we have some great topics of discussion with him. Before we get back into our interview, I want to remind everyone how you can contact us here at Morton in the Morning. You can send us an email at any time at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. And we always love to hear from our listeners. If you have any general feedback, if you have any follow-up questions about our shows, or if you have any suggestions, what topics would you like to hear about in the coming weeks? We'd be happy to bring on some guests and talk about the health and wellness topics that you would like to know about. And as always, at the end of today's show, we do have some updates to share, some shout outs to our staff, and I also want to talk more about another hiring event that we have coming up here at the hospital. It's going to be on Friday, February 17th. That'll be a walk-in hiring event from 9 to noon and 2 to 4 p.m. So stay tuned at the end of the show and stay with us as we share those updates. We want to give you all the information, including the positions that we are looking to hire into for that fair. So let's get back to Dr. Thayer. Before we took our break, we were, talking a little bit about him and his team at Morton Surgical and just some of the latest advancements in the surgical department and some of our new specialists and new equipment that we have up in our operating room. Now, wanted to have you on today because we wanted to talk about a particular issue that affects many people. It's something we've never talked about on the show before, but I believe is pretty common, but you'll tell us more about it. So we're going to talk about diverticulitis. Now, there's something also called diverticulosis. I don't know if that's similar. Maybe you can explain the difference for us.
Yeah, so most people, about 60% or more people who are older than 60 have a diagnosis called diverticulosis. Okay. It's very simple. If you think of the colon as a tube, you have little bags that develop little saccules that develop off of the tube that the colon and the intestine is. It primarily affects the lower portion of the lower intestine, which we call the sigmoid colon. Okay. But it can be scattered throughout. The interesting thing is there's very few people who are 20 years or younger that have this, and the majority of Americans have it by the age of 60.
So that's diverticulosis.
That's diverticulosis.
Okay.
That is the non-infected, non-disease portion of what is a natural progression of how we age.
Okay. Diverticulitis is different.
Diverticulitis is when the opening to one of these little saccules or bags gets obstructed, and then what happens behind it? You develop an abscess, and that abscess becomes diverticulitis.
Okay.
Now there are certain Latin roots that go along with this, Julie. You know, itis in Latin means infection, and osis just means sort of present. So it makes a difference in how you say the word. We get a lot of people who come in and say, "Oh my gosh, I have diverticulitis," and you have to go say, "No, it's diverticulosis."
Okay. And the osis is common in people after age 60, you said.
That's correct.
How common is diverticulitis?
Diverticulitis occurs, we believe, in about only 4% of the people that have diverticulosis.
Oh, okay.
The degree of it, and this is an ever-changing dynamic. The people who get infection from their diverticulosis runs much less than about 10%. Since we have all sorts of ways to tell whether people have diverticulosis now, for instance, like CT scans.
Okay.
And, you know, everybody age 45 or older is supposed to get a colonoscopy. So more people know that they have diverticulosis than ever before.
Okay.
And before, we used to not know that people had diverticulosis until they had a bad infection.
Okay.
So you can see, 40 years ago when I began in training, we used to believe that, you know, if you had diverticulosis, well, it was only natural you were going to eventually have something bad happen. Nowadays, we realize there's a lot of people with this and nothing bad happens.
Okay.
We believe that about 20% of people who have diverticulosis may have some symptoms like bloating, constipation, but they really don't seek medical help for that. They may, if they saw their doctor for it, that would be the diagnosis. Oh, you have diverticulosis.
Okay.
But really only about, the most recent study is 4% of people actually ended up in the hospital or requiring antibiotics.
Okay.
And even a subset of that requires surgery for that. Now, it's not so infrequent that I wouldn't say around here we do, you know, several of these sorts of procedures a month for this. But it, on the grand scheme of how many people have diverticulosis, not that many people actually get sick from it.
Okay. Now, when it does progress, or they do get diverticulitis, do they have more severe symptoms with diverticulitis?
Oh, yes. Diverticulitis implies that you're sick from the infection that has occurred surrounding one of these saccules. And usually it is in the lower colon that we call the sigmoid. And usually somebody will seek help from their regular doctor. Okay. Or they'll seek help from our emergency room.
What are they experiencing? Is it painful?
Severe pain.
Okay.
In the left side of the abdomen, usually, but it could be just the lower side of the abdomen. And it's just severe pain. They may tell you, I feel bloated, I'm constipated. They may say, I've occasionally seen blood in my stool. And they are very tender when you push on these areas.
Okay.
Even then, the vast majority of people nowadays can be treated with antibiotics by mouth and can be discharged home.
Okay.
Some people are so severe that they do need to get admitted and have intravenous antibiotics. And nowadays, in this current day and age of modern antibiotics, it is rare that somebody needs to go on to have emergency surgery for that.
Okay. Now, the symptoms that you explained, it sounds like there may be other things that have similar symptoms. Does it get confused a lot with other types of emergencies?
If you have bloating, intermittent crampy abdominal pain, there is a syndrome called irritable bowel disease, which is often confused with diverticulosis.
Okay.
They're very similar, but it's not confused with diverticulitis. When you have terrible lower abdominal pain if the doctor pushes on you in this tremendous tenderness and you have a fever, or maybe some of your laboratory values are off. The primary diagnosis is diverticulitis.
Okay.
And that is now, in this day and age, confirmed by a CT scan.
Okay, I was going to ask, now you said CT scan. Do they always have to do a CT scan to diagnose diverticulitis, or?
There are many seasoned, experienced physicians that the first time you go to them and they say, oh, you probably have diverticulitis, let me give you an antibiotic. And it gets better, and that's most likely what the diagnosis is. And then later on, of course, they're going to ask you to do a colonoscopy to confirm that diagnosis.
I see.
I would say if you come to the emergency room, if you feel you're sick enough to come to the emergency room instead of your regular doctor, then most likely you're going to get a CT scan.
Okay.
And you're going to make we're going to make the diagnosis that way.
Okay. Now, you had mentioned these sacules, that there's some sort of infection or a problem and that causes diverticulitis. Is that the only thing that causes diverticulitis? Because you often hear people talking about how, like, diet being related to diverticulitis. Is there a relation there?
I'm glad that you asked that. If you have diverticulosis, and even if you don't, let's just say you're older than 60 and you have a better than 60% chance to have significant diverticulosis, you want to prevent coming to the hospital, and you obviously want to prevent coming to see me because you don't want to have, the incisions that come along with an operation and things like that. That's inconvenient for people.
Absolutely.
So we like to prevent that. We want to keep people healthy. So the main way to prevent diverticulosis from transitioning to diverticulitis, or the type of sickness that causes, is with a high fiber. We like people to have enough fiber in their diet.
Okay.
And that's thought to be one of the reasons that the North American population has perhaps more significant diverticulosis than other countries, is because we probably don't eat enough fiber in our diet. So it does get a little confusing, Julie. I know I don't like to confuse the audience, but some of us are born with diverticula, but most of us acquire diverticula through our life.
Okay.
So you can have even a young child that might say, oh, I have diverticula. That's the type that they're born with, so that's congenital.
Okay.
And then there is the type that we acquire. We're talking about trying to prevent acquired diverticulosis, and we particularly don't want to have it become diverticulitis. And right now, the only way that we think to prevent that is with fiber.
Okay.
And I urge almost all my patients to take some sort of fiber supplement, because the American diet, unless you really strain to get 15 grams of fiber every day, you'd be eating unusual for a common American to get that much fiber.
Okay, well, lots of great information. Hope our listeners are enjoying this so far and learning a lot about diverticulitis and diverticulosis. I have a lot more questions for you. I definitely want to talk a little bit more about, treatment options, when surgery is required, what that procedure is like. But first, we are approaching the halfway point of today's show, so it is time for us to take another break. But if you're just tuning in, we are here today with Dr. Charlie Thayer, General Surgeon and our Chief Medical Officer here at Morton Hospital. We are talking about the topic of diverticulitis. Maybe you've had it before, maybe you know someone who has, maybe you fall into the high-risk category of people who are over 60 that would have diverticulosis and could potentially get diverticulitis. So you'll want to stay and listen. We have a lot more with Dr. Thayer on this topic, and we will be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have welcomed 3 new doctors to our community. Dr. Margaret Sywinska and Dr. Yelena Levin have joined our Steward Primary Care of Taunton practice located on Bay Street. For an appointment, you can call 774-501-3229. And Dr. Joanne Sylvia is now seeing patients at Steward Primary Care of Lakeville, seeing patients of all ages. For an appointment, call 508-947-4400.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back. It's the second half of today's Morton in the Morning show. Thanks for listening in today. I want to give a reminder how you can reach out to us here at Morton in the Morning. Send us an email anytime at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. We would love to hear from you with any suggestions you have for upcoming shows or any feedback about our shows. And today we have a great show. We've already learned so much with Dr. Charlie Thayer, our Chief Medical Officer. He is a general surgeon here at Morton Hospital and has been for over 30 years, which he mentioned. So we are so fortunate to have him. And today we're talking about diverticulitis. And before we took our break, we were learning a little bit more about, what that is and who's at risk for it. And Dr. Thayer mentioned that people over 60 are more likely to have diverticulosis, which could ultimately turn into diverticulitis, hopefully not. But also that some people can be born with diverticula. Now, why would someone be born with it? Is it hereditary?
No. So, Julie, believe it or not, we're all sort of born with imperfections sometimes. So,
Absolutely.
So these are just one of the things that there is no firm basis for the hereditary basis of having diverticulosis.
Okay.
There's been a lot of conjecture about it, but it's not. Now, I would like to mention one other thing.
Sure.
In the prevention of becoming infected from your diverticulitis, and that is smoking. That's thought to be somewhat associated. And of course, so like all the things that we're told are bad is somewhat associated with diverticulitis. So smoking is definitely related, and being maybe a little overweight is related. But these are not nearly as related as not having enough fiber in your diet. That's the overarching thing.
Okay. So if someone starts to have symptoms, they're getting worse, what do? Do they call their primary care?
Yeah.
Does it depend on how severe the pain is?
Well, people who recognize that they're going to have horrific abdominal pain and fever know that they're going to go to the emergency room, but people who are having intermittent episodes, feel unusual, can get an urgent or maybe even a routine appointment with their primary care that can also treat them.
Okay. And so what are the most common treatment plans?
The most common treatment plans is a short term of a broad spectrum antibiotic. Now, I use the term broad spectrum because there's many different types of antibiotics, but it wouldn't be unusual for somebody to suggest that you need an antibiotic named Augmentin for a period of time.
Okay.
Or maybe antibiotics named Cipro or Flagyl. These are the types of antibiotics that have been given. It changes from time to time depending upon your own location and the type of bacteria that affect. Believe it or not, there's different types of different bacteria in different areas of the country. So you might be given one thing one place and another.
Okay.
And generally, as I said, most people who have diverticulitis acutely actually do get better with antibiotics, be it from the inside of the hospital or treated on the outside of the hospital.
Okay. And now when they're treating this with, just the route of the antibiotic, are there any other complications that could happen until it is cured?
Well, there's a certain amount of people who are going to have diverticulitis that are not going to get better with antibiotics, and then that really becomes an urgent or even an emergent case which requires emergency surgery.
Okay.
And that's where the surgeons like ourselves play a significant role. We play the role in two cases. One, the unfortunate people who have really bad, life-threatening problems with their diverticulitis that require emergency surgery.
So that's a severe infection.
And there are, even to this day, about every few months, every couple months probably, we do meet people that require emergency surgery for this.
Okay.
Then we have the person that has had diverticulitis and they've gone to the doctor several times over, several months, or maybe this is the fourth time in 2 years that they're missing work, and they don't like it. And then what we prefer to do is to take that segment out, what we call electively. Because when we take it out electively, Julie, we take it out using those spiffy little TV cameras that we put in your belly, and the incisions are really larger than a couple inches. And everybody prefers to have a couple inches rather than 10.
Sure,
Julie.
absolutely.
So that's
So I was going to ask, what exactly is the procedure? You said taking that section out. So you do actually take a section of the colon out?
You take the area that's been infected out, and then we put the two ends back together.
And how does that happen?
What do you mean, how does that happen?
How do
we
you
sew it back together?
It's sewn? Okay.
Yeah, sewn or a staple. We've been doing, that's the sort of stuff that surgeons have been doing for decades.
Okay.
Really. This is not, that hasn't changed. What has changed is the fact that you can do it through teeny little incisions, and that can be done safely. And of course, people who used to have these operations when I started surgery would spend, 2 or 3 weeks in the hospital. If they were lucky, maybe just one. Now, they have a tendency to go home on the third or fourth day after an operation like this.
Okay, so they would spend time in the hospital after this type of operation.
Yes.
Okay, so tell me about the recovery.
Yeah, if we do an elective, quote unquote, removal of your colon that's bad, most people go home on the third or fourth day.
Okay.
And then they come back and see us in the office on about the 10th day. And we do make sure that we don't want them to eat fiber for the first few weeks.
Okay.
Then we transition them back to, a fiber with fiber supplement.
Okay.
It's rare that you can remove all of the diverticulum of somebody's colon, but it seems and has been proven scientifically and by experience that if you remove the lower colon that we call the sigmoid, then you remove the area that is most likely by a factor of 100 to actually cause you problems.
Okay, so it's unlikely if you surgically remove that portion, someone who has the severe infection or recurring, is it unlikely to come back?
Yes.
Okay.
It's highly unlikely to come back. Now, like everything in medicine, notice I said it's highly unlikely.
Right.
Did I say it's guaranteed not to come back? No, because, the human bodies are different, and I've learned in my 40 years of doing this sort of stuff to really, never say never, because it isn't an exact science. But I can say it's very unlikely, extremely unlikely, that you would be bothered again by diverticulitis.
Okay. And then if someone does have the surgery, they recover, they go home, what's required for follow-up care?
If you're doing fine after 3 or 4 weeks, follow-up care is don't ever stop taking your high fiber supplement. That's the follow-up care. And then of course, you're going to want to have your routine colonoscopy for screening for malignancy, just like anything else. The amount of there used to be a thought process that if you had diverticulosis, you were less likely to have colon cancer. That's completely untrue. So don't let anybody tell you that. So you still have the same risks of having colon cancer. So you still have to do the screening that everybody is suggested to have at the age of 45
Okay.
or older.
All right. So key takeaways, high fiber diet.
Yep.
If you start to have severe pain, don't delay. Follow up with either your primary care, or if it's severe enough and you mentioned a fever, go to your emergency department because it could be something very serious.
Exactly.
Okay. And we have the team here that can take care of it.
Yes, that's in this day and age, I call that sort of bread and butter surgery. Julie.
Okay.
You know, we may do it because of the types of things we've been doing for years. We may do it through teenier incisions and through the type of laparoscopic procedures that across the country, not everybody is equipped to do this. But you can imagine, in the middle of the country, they may not have these sorts of things. But, in the East Coast and the West Coast, this is primarily what you're going to get.
And we're very fortunate, of course, and fortunate to have these services available right here in Taunton, so people don't have to travel, of course, to Boston or even farther.
Oh, yeah. I think that the majority of people that have diverticular disease, in particular, this sort of disease, they probably stick around here because there's very little utility to traveling for this sort of thing.
Okay. Well, lots of great information. I certainly learned a lot. And is there anything else you'd like to share with our community about anything in general?
No, Julie. The only thing I wanted to make sure is to make sure you're taking your fiber, Julie. Are you taking your fiber? I just want to make sure.
I'm not sure if there's fiber in my multivitamin. I'll have to find out. I'll have to look up what foods contain a lot of fiber.
When I see you around the hospital, I'm going to be discussing this more frequently.
I'm sure you will. Well, thank you very, very much. Everyone out there listening, do your research on the fiber, what types of foods, take a supplement as Dr. Thayer suggests, but of course clear it with your doctor first, right?
Oh, yeah.
Okay. Well, thank you again, Dr. Thayer. We look forward to having you on the show again, and maybe we'll discuss another topic of interest to the general public.
Thanks.
All right, well, that concludes the interview portion of today's show. Thank you again to Dr. Thayer for sharing such helpful and informative information about this condition of diverticulitis. I learned a lot, and I hope you did too. And as Dr. Thayer mentioned, they have a great team over at Morton Surgical that is able to take care of you if you have a surgical needs for this issue and many other issues. A whole team over there with various specialties, even outside of general surgery, including breast surgery. So if you need to reach out to Dr. Thayer or a member of his team over at Morton Surgical, you can call their office. There's 2 different phone numbers that you can use. One is 508-824-4535. Again, that's 508-824-4535. And then the other number is 508-823-1101. That's 508-823-1101. And they have those 2 different numbers because they are a pretty big office, multiple surgeons working out of there, and they are pretty busy taking care of our patients and community. So again, need to reach out to them, call one of those phone numbers, or you can also check out our website, mortonhospital.org. All of our doctors are listed there on our Doctor Finder tool, and you can look up their information, their location, their phone number, their specialties, and much, much more. So again, thank you, Dr. Thayer, for joining us today. He is always a great guest. He has a wealth of knowledge, and it's always great to speak with Dr. Thayer. So it is just about time for us to take our last break of today's show. But when we come back, I hope you will stay with us because I want to share information about another exciting hiring event that we have coming up. This week, it's actually on Friday, so stay tuned to hear that information. And we also have a couple shout outs to our staff that we want to share. So stick around. We will be right back after the last break of today's Morton in the Morning show.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
At Morton Hospital, we're proud to be nationally recognized for quality and safety. In addition to recently achieving the Gold Seal of Approval and accreditation from the Joint Commission, the Leapfrog Group has named us as a straight A's hospital for having received 5 consecutive A hospital safety grades since 2020. To learn more about our achievements and awards, visit mortonhospital.org.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the final segment of today's Morton in the Morning show. If you're just tuning in and if you missed our show, we did have a great show with Dr. Charlie Thayer, a general surgeon and also our chief medical officer here at Morton Hospital, very well known in the community, and we were talking about the topic of diverticulitis, which was very interesting. If you missed it, don't worry. We always post all of our shows on our Facebook page. So the shows are up on YouTube, online. We'll share it to our Facebook page, so make sure you follow us on Facebook. If you're already on Facebook, just search Morton Hospital, or you can type right into your browser facebook.com/Morton Hospital MA. So we will share a link to the show later on this week or over the weekend. So you can check them out there, as well as all of our other past shows if you missed any that you really wanted to hear about. So for this final portion, I really want to talk to everybody about our next job fair, which is actually this week. It's this Friday. But first, I want to share a couple shout outs to our staff. The first one is that this week is Cardiovascular Professionals Week. So we want to give a shout out to our cardiovascular team right here in Morton Hospital. Our team that specializes in doing EKGs, echocardiograms, stress tests. They themselves have a lot of heart and are a great team. They take wonderful care of our patients and offer a variety of diagnostic testing. So we want to give a shout out to them, our team here in our cardiovascular department, as well as the providers and staff in our affiliated cardiology department or office, which is New England Cardiology. Dr. George Chalazi and his team, they partner with the hospital in so many ways to take care of all of our patients with cardiac issues. So shout out to those two groups, wonderful teams, and happy Cardiovascular Professionals Week. Also want to give a shout out to our sterile processing department. We call them the SPD for short. And if you follow us on Facebook page, you'll see that we did post a shout out to them last week and posted a picture. We actually bought them lunch to recognize them for the incredible job that they are doing behind the scenes here at Morton Hospital. So we recognize that team. They are unsung heroes. They play a really significant role when it comes to all the surgeries that are performed here at Morton Hospital, because they are processing, cleaning, making sure that all of our surgical equipment and supplies are safe for our patients. And they have had a continuous focus on quality and safety, even as our surgical volume has grown significantly year over year. They are a very busy team and a very efficient team, and again, great dedication and great focus to quality and the safety of our patients. They support every surgical case that's done here, and actually they recently helped us break a record, a first for Morton Hospital, which was we completed 4 ACL repairs in one day, and those were performed by our chief of orthopedics, Dr. Drew Rogers. So that was really something that we celebrated here at Morton Hospital, and Dr. Rogers, our entire day surgery team, and our sterile processing team made that happen. So thank you to our sterile processing department for all that you do. You are incredible team members, and just work in a fast-paced environment and really, really contribute so much to ensure the safe care of our patients when they are here for our surgical procedures. All right, so over the past couple shows, we always talk about our hiring events, and we've had a couple of really successful hiring events actually last week. So we were able to make offers and hire several candidates in a variety of positions, which was really exciting. But we do have many more positions available, and we've even posted a bunch of new positions to our website, which is jobs.steward.org. And if you go to that site, you can search by state, select Massachusetts, then select Taunton and click search, and you'll see all of the open positions at Morton Hospital. Right now we have 190 jobs posted, and that ranges from full-time positions, part-time positions, to per diem positions. So lots of great opportunities if you're looking for a whole new career, you're looking to move from another place that you're working at, or even if you're just looking to pick up an extra job, a secondary job as a per diem or part-timer here. We have many, many opportunities available to you. And we have another hiring event happening. It is this Friday, February 17th. We have a morning session, which will be from 9 a.m. to noon, and then an afternoon session from 2 to 4 p.m. So this is a walk-in hiring event. You can just come, bring your resume, and we will be here with our team to interview you on the spot. Or you can also register in advance. So we have our registration link posted. You can find it on Indeed. Or you can also find it on our Facebook page, which is again facebook.com/Morton Hospital MA, or just search us on Facebook if you're already logged in. So the hiring event, Friday, February 17th, 9 to noon and 2 to 4 p.m. Walk in, bring your resume, be ready to speak with one of our managers in whatever department you are interested in hiring into. But for this particular event, even though it's open for all positions, there are some positions in particular that we really want to highlight and bring candidates in for. And those are various registered nursing positions, CNAs, which are certified nursing assistants, ED techs, which are similar to CNAs, but they really support primarily in our emergency department, unit clerks and unit assistants that really support the work on all of the various clinical floors, imaging techs. We have tech positions open in our CT department, X-ray, as well as ultrasound, and lastly, admitting clerks. So our volume here at Morton Hospital, continues to grow. We continue to grow our various services, and we need to grow our team to support that and for us to continue to provide the best care possible to our patients. So we hope that you'll join us. We hope that you'll spread the word. We have been putting it out there on social media, but please, if you're listening today and you know someone who's looking for a job, send them our way. Tell them to just pop in on Friday anytime between 9 and noon and 2 to 4. We'll be here. We'll screen you real quick. Make sure you have a mask on, and then we'll bring you right down to have an on-the-spot interview and possibly even extend some offers that day. So if you know of any qualified candidates, please send them our way. Or if you yourself is looking for a new career, or to pick up a part-time or per diem position, Morton Hospital is a great place to work. We have competitive benefits. We have an incredible team. We have fun here, and there's just lots of great incentives to work here at Morton Hospital. It's very rewarding working in healthcare. All right, so what can you expect to hear about on Morton in the Morning in the coming weeks? Well, we are working on lining up various interviews. One, we're hoping to get on a couple members of our orthopedics team to talk about the orthopedics department, what's new in that department, as well as including something we mentioned today on the show with Dr. Thayer, which is the Corey robot, which is a robotic-assisted orthopedic surgery that we are now doing here at Morton Hospital with one of our orthopedic surgeons, Dr. Newland. So hopefully we'll be able to get Dr. Newland and Dr. Rogers, our chief of orthopedics, on here in the future to talk about what's new in orthopedics. We will also soon be having a show about the new Inspire therapy program for sleep apnea that we have referenced before. Morton Hospital is actually going to be the first hospital in this region to offer Inspire. You may have heard about Inspire. I know they have a lot of TV commercials, a lot of radio commercials. It is a cutting-edge, innovative new procedure for people with chronic obstructive sleep apnea who aren't able to tolerate a CPAP machine. So really great option for people with really great outcomes, and it is an FDA-approved insert that goes inside of your chest and helps open up the airflow while you're sleeping. So stay tuned for more information about that. We hope to be able to talk about Inspire with you in the next few weeks. But if you have any suggestions, are there topics that you want to hear about? Are there doctors you'd like to hear from? Let us know by sending us an email at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. We are happy to take your suggestions, and we would love to hear from our listeners about how you're enjoying the show and what you want to hear about moving forward. All right, well, that wraps up today's show. We want to thank Dr. Thayer again for joining us and talking about the topic of diverticulitis, among other topics. And again, we want to encourage our community to come and join us at our hiring event this Friday, February 17th, 9 a.m. to noon and 2 to 4 p.m. We're hiring for all positions, and you can walk in or you can register via the link on our Facebook page, and we will have our team here and ready to interview you on the spot. We're looking for great team-oriented candidates to join our team. And we just hope you'll join us because we have a lot of great opportunities here and many different positions to fill, not just nurses, but things like admitting clerks, imaging techs, and so much more. So check out our website, jobs.steward.org, to browse through all of those different opportunities. And please come in and join us for our hiring event this Friday. Again, the best way to stay up to date on what's happening here at the hospital is to follow our Facebook page because we are very active there. If you're logged into Facebook, just search for Morton Hospital, or you can type in your internet browser, facebook.com/Morton Hospital MA. We post almost daily about upcoming events, what's happening. We share pictures of our staff, talk about new doctors and everything else happening here. So make sure you follow us on Facebook and make sure you tune in to us here at Morton in the Morning to hear about some specific topics every week, every Wednesday at 11:05 a.m. right here on WVBF. Thanks so much for joining us. We look forward to joining you again next week. And from all of us at Morton Hospital, we hope you have a happy and healthy week. Need a primary care provider? Morton Hospital and Steward Medical Group have welcomed 3 new doctors to our community. Dr. Margaret Sywinska and Dr. Yelena Levin have joined our Steward Primary Care of Taunton practice located on Bay Street. For an appointment, you can call 774-501-3229. And Dr. Joanne Sylvia is now seeing patients at Steward Primary Care of Lakeville, seeing patients of all ages. For an appointment, call 508-947-4400.